My name's John Chan. I'm a gynecologic oncologist at California Pacific Medical Center. I would like to begin with a message of hope. Although 1.5 million people are diagnosed with cancers every year in the United States, with the advances in treatment, most are in remission or cured from their cancer. About 2/3 of all cancers are preventable. Most of these are caused by excess body fat, physical inactivity, and poor nutrition. We hope to provide information on how nutrition and exercise can prevent you from getting cancer, support you during your cancer treatment, and avoid recurrence during survivorship. Studies on over 50,000 people suggest that consumption of a low-fat diet had a 40% reduction in cancer risk. Other studies also show that a diet high in animal fat, red and processed meat can increase your risk of certain cancers. It is exciting to know that we have a National Cancer Institute study to evaluate the role of diet and nutrition to prevent your cancer from coming back. Working on nutrition is important, but I also tell my patients about the 5 E's of cancer prevention: eating well, daily exercise, avoid unsafe exposures such as the sun, avoid excessive alcohol and tobacco, and lastly, getting examinations by your healthcare provider with screening.
My name is Anca Cunningham, and I am a registered dietitian. During active cancer treatment, there are changes to how your body uses food, and this requires a higher level of nutrition support to help you cope with the side effects of therapy. You may be confused about the conflicting messages you get about nutrition and cancer. You may get a lot of advice about food from well-meaning friends, family members, and even strangers. Ask your healthcare provider for a referral to a registered dietitian to receive individualized advice that will meet your needs. While undergoing active treatment, you may benefit from a structured food plan with set eating hours and reminders about eating. Now let's discuss side effects of cancer therapy and ways to manage them through food. Mild to severe diarrhea or constipation, appetite changes, taste changes, or nausea, vomiting, mouth sores, or feeling full too soon. Also, tips on preventing too much weight loss. For diarrhea, eat soluble fiber, which helps create formed stools. We usually recommend brat foods: banana, rice, applesauce, and toast. In addition, avoid caffeine, sugar-free gum, and sugar-free candy. For constipation, eat fiber-containing foods that stimulate movement of the bowel, such as a variety of fruits, including fresh and dried, and of course the all-time remedy, prunes. Vegetables are a versatile ingredient to be served either fresh, cooked, or pureed. You can always add lemon, ginger, or herbs to flavor your veggies depending on your taste and appetite. Use your favorite whole wheat toast or crackers for dips like hummus and guacamole. Legumes are another great addition to soups, such as lentils or sweet peas. Nuts and seeds provide a nice blend of healthy fat, protein, and a little bit of fiber in a small volume of food. And don't forget daily walks, which can help stimulate movement of the bowel. In addition, walking can improve fatigue and may be a mood booster. Because of appetite changes or a loss of appetite, small frequent meals, snacking, or grazing is highly recommended. So remember to bring some snacks when you go out. For nausea, you may find foods that are cold more appealing, such as sherbet, ice cream, refrigerated melon cubes, or frozen grapes. Furthermore, you may find it helpful to avoid foods with strong smells. If you have sores in the mouth and throat, this may drastically limit your interest in food. Eat soft and well-cooked foods that are on the bland side, such as mac and cheese, eggs, and mashed potatoes. I recommend staying away from foods that may worsen the pain from your mouth sores, such as salty, spicy, or acidic foods. Your healthcare provider may prescribe medications to alleviate diarrhea, constipation, nausea, as well as managing mouth sores. If you are losing weight during your treatment, you may need to eat foods higher in calories. It can be as simple as adding honey and butter to your oatmeal, choosing higher-calorie fruits, adding extra oil or cheese to foods, or adding avocado to a turkey or chicken sandwich. In addition, you may benefit from drinking commercial nutrition supplements. Maintaining nutritional status and keeping weight stable are of prime importance as they correlate with better tolerance to treatment and improved treatment outcomes. Other dietary steps that may apply to you during active treatment include high-protein foods. You need to eat more protein during active cancer treatment than during states of health. Protein helps build new healthy cells to replace the cells destroyed during treatment, and this in turn helps your body fight infection. Hydration. You want to make sure you replace fluids lost during episodes of vomiting or diarrhea, as well as drink enough fluids to cope with bouts of constipation. Add cucumbers, watermelon, or lemons to your pitcher of water so it looks yummy to drink. And remember, hydration can include fluids other than water. Food safety and sanitation. During active cancer treatment, your immune system may be depressed. This requires extra attention on your side to keeping food safe. Simple rules to remember include washing hands often for at least 20 seconds, clean, separate, cook, chill. A few ideas are: defrost as well as marinate all foods in the refrigerator, never on the counter. Prevent cross-contamination by keeping foods and utensils separate during different stages of food prep. Cook meats to the recommended internal temperature. Keep hot foods hot and cold foods cold, and avoid eating at buffets. Refrigerate or freeze food within 2 hours from cooking or buying it. I hope this information has been helpful to you. There will likely be some changes to your nutrition needs during active treatment. Once you complete your treatment, then you can continue to work with a registered dietitian to revise your needs.
Now that you have finished your cancer treatments, it may take many months for you to feel physically and emotionally well. Be patient and compassionate with yourself as you rebuild back your energy, and try to do some of the following. Eat a well-balanced plant-based diet with lots of hydration. Slowly increase physical activity, but please get lots of rest and sleep. Try to manage your stress with guided imagery, meditation, and yoga. You may even want to join a support group or consider counseling if needed. And surround yourself with loving family and friends. You have worked so hard to get to this point. You want to have a meaningful life filled with love, laughter, and joy. And don't forget, love comes in many ways.